Hello everyone and welcome to today's training. My name is Elodie and I'm part of the marketing and communication team at MEDFAR. So we are going to start the training with Eda, our learning and development specialist. Eda, you can go.
Thank you, Elodie. Good afternoon. Before we begin, if you want to ask a question, you can use the questions section in the right margin as illustrated here. A member of our team will attempt to answer it during the webinar. Additionally, some questions will be selected to be answered orally at the end of the presentation. In our agenda for the session, we'll be talking about our new partner, the details of this feature, as well as an overview of how it works. Then we'll see what to do if you wish to be connected to this interface. And finally, we'll go over the questions our attendees might have. So let's begin. This interface allows MYLE to connect with our partner, Bonjour-santé, the online appointment booking platform. It will allow our users to save time and reduce the risk of errors by avoiding having to manually enter in MYLE the appointments that are booked through Bonjour-santé. Now let's see some context details. This feature allows MYLE to receive appointments scheduled through Bonjour-santé for a clinic, as well as appointment updates and patient information. The main objectives for this feature are, first, to enable the joint use of the Bonjour-santé and MYLE calendars. Second, to offer our clients the possibility to expand their online booking offer to better serve orphan patients. And third, to increase the tools we offer to our clients, in particular, walk-in clinics. Some specifications to note. When an appointment is booked, Bonjour-santé searches for the patient in MYLE. If the patient does not exist in MYLE, Bonjour-santé will automatically create it. Bonjour-santé will also send MYLE any updates on the patient's preferred pharmacy and NAM expiration date. So now the feature overview. As a first step, the clinic would have to log into the Bonjour-santé platform to open the scheduled slots they wish to offer to the patients. Then, when a patient finds and books an appointment at the clinic through Bonjour-santé, the platform will search for said patient's file in MYLE. Bonjour-santé will then send certain information to MYLE, the nature of which depends on whether the patient already exists in MYLE or not. So when it is a new patient, Bonjour-santé will send to MYLE the patient's first name and last name, their NAM, the NAM's expiration date, their phone number, address, email, preferred pharmacy, and reason of visit. However, if it's an existing patient, Bonjour-santé will only send to MYLE any updates on the NAM's expiration date and preferred pharmacy. Note that this information update is currently in development. In any case, if the patient does not exist in MYLE already, it will be created automatically by the Bonjour-santé interface. Appointment booking. So now, an important note on the way this interface works. MYLE and Bonjour-santé do not have a bidirectional connection to exchange information regarding calendar availability. This is why we mentioned earlier that the clinic needs to open their scheduled slots or availabilities in Bonjour-santé independently from MYLE. Therefore, there are some important things to consider. One is that due to this, double booking may occur. Two, if the clinic is using the gray bubbles, also known as service type of availabilities in MYLE, the bubbles will not be deleted when an appointment is booked through Bonjour-santé. And third, because any changes made to the scheduled slots or availabilities in MYLE are not reflected in the Bonjour-santé platform, the user would need to modify the scheduled slots in both platforms, meaning a duplication of work may be necessary. However, there is a way to avoid these potential issues. A recommended procedure is the following. The clinic must allocate a space in their MYLE calendar exclusively for appointments coming from Bonjour-santé. This space is not to be used for other purposes. Here are the steps to follow. In order to do that, the clinic should first create a new service for Bonjour-santé. Then, it should open a scheduling rule with the new service in the practitioner's calendar. Finally, note that when booking an appointment from a patient's file, the user should never choose the service created for the Bonjour-santé appointments. Doing this is a way to signal that the space in the calendar is not to be used by the clinic for other purposes, only for receiving Bonjour-santé appointments. And also, this is useful to inform the practitioners of their schedule. So first, as we said, the clinic will create a service that will be called Bonjour-santé, and it will look like this. We fill out the usual fields on the left, the name, duration, site, specialty, employees. And then we'll leave the boxes on the right unchecked. The clientele, we can leave it as open, which is the default. Once we do that, we create the scheduling rule and open the availability in the practitioner's calendar, like in this example. Here, the space from 8 to 10 will be used exclusively to receive appointments coming from Bonjour-santé. Again, the purpose of this scheduling rule that you see here is only to make sure the space is not to be used by the clinic for anything other than receiving appointments from Bonjour-santé. Once an appointment is booked through this interface, it will look like a regular MYLE appointment. The main difference is we can see in the notes section in the appointment details that the appointment was booked through Bonjour-santé, as we can see here. Now, regarding the notifications. When an appointment is booked, in order to prevent the patient from getting notifications from both MYLE and Bonjour-santé, our API will proceed to disable all notifications for this interface. This means the patient will be getting notifications from Bonjour-santé, but not from MYLE. Now let's look briefly at some usage statistics. In the 6-month period since the deployment of this feature, the Bonjour-santé and MYLE integration facilitated the booking of 55,443 appointments for the 21 clinics that are currently connected. This means that thanks to this feature, these clinics were able to decrease the risk of human error and the amount of employee time this task would have otherwise required. That being said, let's now look into how to connect. If you're interested and would like your clinic to have access to this feature, follow the next steps. For essential or any new potential clients joining us today, we invite the clinic administrators to send an email to vaunt.quebec@medfarsolutions.com about your interest. A sales representative will be happy to assist you. If your clinic has a premium or ultimate package, then we invite the clinic administrators to contact our support team to request the activation through our support email or by phone. We will now look at some frequently asked questions. So how does Bonjour-santé search for a patient in MYLE? Bonjour-santé can search for a patient and their appointments in MYLE using either the combination of the patient's last name, first name, and date of birth, or by using the patient's health card number. If the patient does not have a file in the clinic, Bonjour-santé will automatically create one. If the search finds more than one possible result for the patient's file in MYLE, then a new patient file will be created instead. Can Bonjour-santé modify appointments already sent to MYLE? The answer is yes. It is possible for Bonjour-santé to modify or cancel an appointment. However, because of the way the interface works, if the clinic deletes or modifies the appointment from MYLE, it will not be canceled or modified in Bonjour-santé. Our last question, how will the interface between Bonjour-santé and MYLE be connected to the hub? In theory, once Bonjour-santé and MYLE are connected to the hub, everything will go through the hub. The Bonjour-santé functionalities that are not integrated to the hub, such as the management of the waiting room or the reduction of the waiting time, will always go through the Bonjour-santé interface. More information on this will be communicated as the development of the hub interface progresses. So now, if you have any questions, please feel free to ask. So thank you for joining us today. Should you have any other questions, you can always email us at our info@medfarsolutions.com email. Thank you.